Well, we're back, everybody. We are rolling today. I'll tell you what, it's been jam-packed already, and we just had a great call with Christine Glein, and now we've got one of our great vendors up, and I think this is the first vendor presentation of the week. So let's welcome everybody. Mac Haynes. Mac is the supplier of probably one of the most impactful new ingredients we've had here at the World of Wellness, and that's our IgG formula. I gotta tell you, Mac, this has been already. People are going, it's flying off the shelf, using it in conjunction with our GI Complete formula. Wow, we're getting great results. So people really want to
Awesome.
know why. They
Yeah.
want to know, what is it about this? What makes it different? Yeah, and what is it that just sets it aside, and how does it have such a big impact on gut health? So, folks, without any further ado, I'm going to turn it over to Mac, let him give you his expertise. We'll be back for some question and answers in a little while, but Mac, the stage is yours.
Awesome. Thanks for having me again. I'm really excited to talk a little bit more about IgG. Very great for supplementation for anyone with GI distress. We're just trying to go to the underlying condition of that GI distress, which is that bad bacteria that causes inflammation in the gut. We'll bind onto it and remove it from the system before it can cause the inflammatory response. I prepared a little slide deck today, actually focusing directly on SIBO. We know SIBO is obviously a hot word right now. A lot of people are coming in feeling bloated, feeling just a little too full, not wanting to obviously get out in this great summer weather we're about to have out in their swimsuits, just because they're feeling a little bloated. They're feeling like they're a little inflamed on the inside. And now you have Immunolin and Nutritional Frontiers IgG that's going to go to that bloating, that cause of it, and remove it from the system, so then they can get back to that healthier living, feeling better, and overall just a better living. So here we go. We'll talk a little bit about Immunolin. Immunolin is the active ingredient in Nutritional Frontiers IgG. My name is McLean. As you said earlier, I'm kind of the bringer of this ingredient for Nutritional Frontiers. I brought it on over for them. I'm originally from a small farm in Southwest Iowa, and pursued my Bachelor's of Science at Iowa State University. I've always been an Iowa boy. And it's just lucky enough that Intera Health, it's located here. All the manufacturing of this ingredient is done here in Iowa. So I got to stay here and also help on the farm on the side. But I spent a lot of time outdoors with my fiance there. You can see in the top right. And spent a lot of time with my family, friends, and of course, Go Clones, support them through all their sports. Love to watch football and basketball. And we kind of have a good pot stirring right now with them. But today's presentation focus, we're going to look at all disease begins in the gut by Hippocrates. We all understand that if we can heal up that gut lining and take in more water and nutrients, it just leads to a better living for our patients and for customers. So I'm going to talk about what is Intera Health and Immunolin. What is SIBO? How does it work? The SIBO data that we have with this IgG concentrate. And I'll conclude and obviously end it with a Q&A to answer some questions that we mostly come across when people ask, how can this help with SIBO? Perfect. So who is Intera Health? Intera Health was founded in 2011, but the Loritzen Group, who has been here for years, over 40 years, have been here constantly looking into different plasma proteins and how those can kind of benefit today's world, as well as on the human health side. So we're headquartered here in Ankeny, Iowa. Again, we're a privately held biotech company focused on the research and development of animal source plasma proteins for global human health and nutrition applications. We actually launched a medical food that's by prescription only still. It's called Interrogam. And the active ingredient in Interrogam, which is serum bovine immunoglobulin, is actually the active ingredient in Nutritional Frontiers IgG. So we got approval by the FDA to lower the dosage and launch this into the supplement market. And now you got this great ingredient that's going to the underlying condition of this GI distress. And Nutritional Frontiers has it in their IgG product, which is great. Immunolin's been extensively studied since 2012. We have over 45 published human clinical manuscripts. Behind it, 6 placebo-controlled clinical studies on IBS-D, digestibility, pediatric IBS, HIV enteropathy, as well as some open-label pilot studies and some case series. But don't want to bore you with all that research. Let's go ahead and dive in. What is in Nutritional Frontiers IgG. So like I said, it's a serum-derived bovine immunoglobulin protein isolate. And since it's serum-derived, we're able to get the highest concentration of IgG in the market. You may be asking, what's IgG? What's immunoglobulin? Think of it as an antibody concentrate. So it's just running through the system and it's binding on to different types of bacteria that causes GI distress and removes it from the system. So what you got here is the highest concentration of IgG. IgG is also the most polyclonal antibody, so it binds onto more stuff, making this just one of the best ingredients you can have in the market. And with Nutritional Frontiers having it, just makes it one of the best GI health and digestive health products you can buy. It's got 60% immunoglobulin, 50% of that's going to be IgG. It also is backed by over 40 human clinical trials, like I said earlier. And it's free of lactose, gluten, soy, dyes, pesticides, antibiotics, and hormones, which we know are areas that can cause GI distress. So we want to get rid of all that stuff and just give you a really concentrated, clean protein here that you have with IgG. And it also is the only flavored standalone Immunolin product in the market. So what you got here is something that tastes great. It's easy to use, goes into solution with whatever you want. But again, it's flavored lemon, lime, raspberry. It's going to go into your water. It's going to taste great. And it's something that you can just take on the go and also enjoy drinking, which I think is a huge factor. Definitely changes the game here. Nutritional Frontiers does with this flavored IgG product. So as we get into it, what is SIBO? SIBO is small intestinal bacterial overgrowth. Just think of it as there is just too much bacteria that's migrated within the small intestine, and then it's just feeding on all those sugars. In that Western diet, we like to eat a lot of different sugars and a lot of different areas that can cause inflammation, and it's just feeding on it and reproducing and just taking up more and more space, leading to that bloating. And it's just slowing down the motility of all the food that we're taking in. And when that happens, slower motility is going to lead to abdominal pain, discomfort, like I said, bloating, diarrhea, nausea, constipation, as well as gas. Again, when that gas is broken down into methane, it's just going to increase that area within the small intestine and just make it more uncomfortable for those patients. So what can IgG do for everything that's in there? How does IgG help? How can these two products actually help you with that small intestine and get some things moving? So it binds and removes these guys. It binds and removes that bacteria that's in there that's taking up too much space, causing that methane and that diarrhea and that bloating. It's going to bind onto lipopolysaccharide as well as C. diff toxins A and B. Outside of SIBO, you also have C. diff, C. difficile. So this is actually going to bind onto toxins A and B. It can work great for that GI distress as well. Also binds onto flagellin, which is another antigenic bacterial component, zymosin, a fungal cell wall component, and then as well as whole bacteria. You're looking at some big ones here: E. coli, gliadin. For those gluten-sensitive patients, we know when gluten's broken down, it does create gliadin, which causes GI distress. What you have here is an antibody concentrate that will bind onto gliadin and remove it from the system before it can set off that low-grade inflammation. Binds onto H. pylori, which we know is a big name right now, staphylococcus, pneumonia, salmonella, and just a couple here that I listed. It binds onto about 40 that we know of right now, but we are constantly doing more research, wanting to find out more different types of antigens and bacteria that causes inflammation and how this antibody will bind onto them and remove them from the system. Here's a little bit of a closer look at the mechanism of action in there, just to showcase what's actually going on in the small intestine. So what you have here is a cross-sectional cut of that epithelial lining. And on the top circle there, you see everything in green. Again, that's that lipopolysaccharide, E. coli, H. pylori. That's what's causing this inflammation in the gut and slowing down the motility through the small intestine. And everything in that Y shape is going to be this antibody actually binding onto them, neutralizing them, and then moving them through the system, removing them from the body, so then we can get a good flow going through and none of that inflammation. So when you decrease the antigen penetration through your epithelial lining, you're going to reduce the amount of antigen uptake and immune activation by your immune cells. Those immune cells are the main activator to set off an inflammatory response, and it's from these antigens slipping through that epithelial wall. So with this antibody concentrate, IgG, you're going to be able to bind onto those and remove them before they can slip through. Now your immune cells are going to work for you. Since they're not sending out an anti-inflammatory response, they will know to send out an anti-inflammatory cytokine response. In this case, TGF beta will be released by the immune cells. Now your inflamed gut barrier that was all charred up and separated will begin to contract together and restore those tight junction proteins. And again, when you restore those tight junction proteins and the gut barrier contracts to a healthier lining, you're going to be able to improve those patients and those customers' nutrient utilization. They're taking in more water, protein, and the nutrients they need to live that healthier, happier life. So what you got here is IgG going to the underlying condition of that SIBO, that small intestinal bacterial overgrowth, and it's going to help move things through and get that gut barrier back to a healthier barrier. So it's a great ingredient, a great product for them. So how do we know it's working for the SIBO case? This was actually one we did with Dr. Leonard Weinstock down in St. Louis. He was actually a non-believer in the idea of using serum IgG. You know, he was really strictly with rifaximin, which is a broad spectrum antibiotic for anyone with SIBO. And what we know from antibiotics is they are great at going at bad bacteria, but they also take out the good bacteria. So the ecosystem that was in there is now going to be replaced with different types of bacteria that you don't know if it's going to breed bad bacteria and cause inflammation within the gut. So what we wanted to showcase here is, okay, if you like to use rifaximin and you've told us that, you know, about 50% of those patients are refractory to rifaximin, eventually come back to having GI distress. Once they're refractory, we want you to use 4 weeks of Immunolin. And that was at 5 grams of Immunolin. So those IBS-D patients that were lactose breath tests, meaning they were positive for SIBO, they were given rifaximin. And if they were unresponsive or refractory, they were given 4 weeks of Immunolin. And then those lactose breath test negative patients, if they were negative for SIBO, they were just given other traditional therapies. And if they were unresponsive, they were given 4 weeks of Immunolin, or IgG in this case. The results for this were great, and it made Dr. Leonard Weinstock a big believer in the product. And now he's currently prescribing our medical food all the time because this serum IgG is working. What you got here is those positive lactose breath test patients that had SIBO, when they were refractory, you know, around 73% of them saw a positive response using Immunolin or the serum IgG in their diet. It's helping lower that inflammation in the gut and remove all that bad bacteria that was slowing down that motility like I was talking about. So when they were positive, they saw 73% of the patients saw success. And then when they were negative, 77% saw success. And then for IBS-D patients, those, you know, they were diarrhea, going to the bathroom all the time, about 70% saw a great response. And then the IBS-M patients in this, those are binge purgers. Those are someday constipations, and then they move over to diarrhea. So by using this product, they're able to restore that gut barrier lining and then reduce those symptoms for those patients. And 88 to 90% of those patients saw a positive response using the serum IgG in their diet. So this is a great study that was specifically targeted at SIBO. And we just wanted to showcase that. Why not just skip the middleman? There's going to be no prior auth. You're not going to have to use a broad spectrum antibiotic to knock out the good and the bad bacteria. Use serum IgG. It's going to go after just that bad bacteria that's causing that inflammation and remove it from the system. And then how can IgG stop bloating, intestinal overgrowth in its tracks? Like maybe IgG could get ahead of SIBO, and it absolutely can. So this serum IgG is very concentrated. We say, you know, it's got to be about a 20-second stir in your water before it goes into solution. And we want it to be that way. It's designed to take a little bit because it's supposed to survive the entire GI tract. It's not supposed to just be digested in the stomach or the small intestine. It will survive the entire GI tract. And from this study by Dr. Jason and Dr. Burnett, you can see that the survivability of this IgG is all the way outside of the body. What this showcased for us was that IgG can be found in poop stools. It finds bound antigens actually in the poop stools. That's how we know that the IgG is working the entire way through the system. It's also non-systemic, so it's never making its way into the bloodstream. It's just working through the GI tract to bind onto that bacteria, like I said, and removing it from the system. So this was a great study, again, just to showcase that it will survive the entire GI tract. Maybe even your IBD patients could benefit from using IgG. Since it is non-systemic, it would be great co-therapy kind of tag teaming whatever the problem is the patient had, because it will work its way into the large and through the colon. So again, IgG is going to be a great therapy that's going to survive the entire GI tract and removing that bad bacteria, which we know is causing inflammation in the gut. Some therapies mask the problem. IgG is going to address it head on. So while we make our way through, again, we're just going to address it head on and remove all the bad guys. And then the top 5 reasons why everyone should take IgG. Again, number 1, it's safe. It has GRAS status with the FDA, which is regulated as safe. A lot of supplements are just out in the market, but they don't actually have a GRAS status with the FDA, which is it's going to be regulated as safe, as it's been tested. There's no major adverse events when taking an IgG or Immunolin product that Nutritional Frontiers has here with IgG. It works differently. It's targeting the underlying cause of that dysbiosis. So why wouldn't you use a product that's going to bind onto what's causing your problem and remove it before it can cause the issue? It's backed by real science. Again, over 40 plus successful human clinical trials, and we're currently doing more and more. We want to find more antigens it binds onto and other disease states where it's going to fit in great and help patients in the long run. And it's easy to use. It's mix it, shake it, take it. It's a flavored IgG product. So put it in your water. I've tried both. The raspberry and the lemon lime are amazing. They did an amazing job over there flavoring this product. And, number 5, anyone can take it. Ages 2+ for anyone who wants to improve their digestive health, immune support, and just their overall wellness. As we sum up these slides, I know there's some questions we're going to have here at the end, but healthy gut, happy life. Why not use serum IgG or Immunolin, the active ingredient here, to actually go at the underlying cause of your GI distress and then remove it, helping you out, live a healthier, happier life. Great supplementation. I know we got some questions out here at the end. I hope I didn't rush too quick through this. What do you have for me there?
No, you're good. How are you, Matt? I appreciate you coming out. I just wanted to say you're really well spoken, and I love having you on because it's very clear, and
yes, of course.
We have really good results with IgG. And I've heard so many good things, like how great it tastes, everything about it. It's very good. We do have some comments in the chat. Okay. I have one that says, we know this is going to help with bacterial overgrowth present in SIBO, but what about fungal overgrowth in the small intestine?
Great question. As you know, SIFO is also a hot word, small intestinal fungal overgrowth. And we know that this antibody does bind onto zimosin, which is a fungal cell wall component as well. We are always looking into deeper on if this product will help with a fungal overgrowth. We currently are going through a Candida trial right now to see if it binds onto different strains of Candida as well as other antigens. And I will keep you guys updated and send you that information as soon as it comes out. It's going to be great data for your team to have. But yes, if you think that an antibody concentrate is going to reduce the amount of fungal issues that you have in there and get that moving as well, this is going to be a great product for you.
That's awesome. All right, we have a few more. What is the onset of action for IgG, and when can a patient expect to see the results from this?
Okay, great question as well. So the onset of action, that all depends on the patient or the customer severity. If this is someone that has had low-grade inflammation or GI distress for years on years, it's going to take a little bit more IgG for them to truly see some results in a long time. So maybe that comes up to 2 to 3 scoops of using this IgG, which is great because they have the variability to actually do 3 scoops while using this product. But you just want to overload the amount of bad bacteria that's in there. That's slowing the motility. So what you have here is a product that, it's going to bind onto and remove bacteria. But if it's someone with a lot of bacteria, like those SIBO patients, it's going to take just maybe a week to 2 weeks before they're seeing those optimal results. So another thing about this product is a bound antigen within the GI tract is going to take up more space than an unbound antigen. So those patients or those customers may be like, I'm feeling a little full after the first 5 days. Why am I feeling full in this product? I thought it was going to lower that. That's good. That means it's working. That means it's binding that antigen, it's increasing its overall size, and then moving it through the system. So again, keep supplementing with the product. That's how you know it's working. And you'll be seeing optimal results again in that 2 to 4 weeks range.
It's really not that bad comparatively. We have a lot of products here that have very effective rates, but it takes like 3 months, something like that. But IgG, like you said, 2 to 4 weeks. That's really not that long.
Yep, absolutely. It's a great product.
All right, we got one more here. Can I take any other medication or supplements at the same time?
Absolutely. IgG is great co-therapy with your probiotics. Anything else that you have that may be causing or maybe helping that gut barrier, because it has no drug-to-drug interaction. There's a lot of gastroenterologists that use serum IgG with probiotics. Probiotics are going to feed that good bacteria. Well, we're going to actually just pull out all the bad stuff while not acting on that good bacteria. So Nutritional Frontiers, I know you guys have some great probiotics over there. Great supplementation. They've been using it with their GI Complete as well. Again, it's just a 1-2 punch. You got something pulling out the bad stuff while it's healing the gut lining with all the good stuff. So again, there's going to be no drug-to-drug interaction with this product. A lot of trials to showcase that as well. So this is going to be great co-therapy with anything else people are using.
Yeah, I've heard great things about IgG and GI Complete. They both come in lemon lime too, so it's not like
makes it easy.
Any weird flavors, right? Mm-hmm. Yeah.
So that's actually awesome. Could probably speed up the onset of action for those other products. With a healthier gut barrier, you're going to take in more nutrients. You're going to take in more water, more L-glutamine, all that good stuff to nourish the gut lining. So it could actually help increase the onset of action for those with a healthier gut barrier.
That's awesome stuff, Mac. Thank you again for everything. Your presentation's always great.
Yep.
We look forward to seeing you next time.
Awesome, Phil. Well, thanks for having me, guys. It was great hopping on. I know I kind of got through this one quick, but
that's totally okay. I mean, it was a lot of huge information. It was just jam packed.
Absolutely. If anyone ever has any questions, I did leave on that last slide my phone number and email. Feel free to ask me any questions you have on Immunolin, the active ingredient in Nutritional Frontiers IgG. Go get it today. Go to the underlying condition of your GI distress. Get with IgG.
Awesome. Thank you, Mac. All right, guys.
Thank you.
We have Dr. Phil Ross, Dr. Orbach, and Joe Messino coming up. So stay tuned in just a few minutes, okay? Thanks.